Hello guys, welcome to my channel. Today we are going to study UP NHM CHO question papers which is held in 7 September 2022. Which of the following is an unfavorable factor for anterior long rotation of the occipital in case of occipital posterior position? Option number 4, premature rupture of membrane. Which of the following type of malaria is the most dangerous and life-threatening and causes black fever? Option first, P. falciparum. What is Marfan syndrome? Option 4, autosomal dominant state. Sperm maturation occur in the option first, epididymis. Question number 5. The most critical time in the treatment of a woman suffering from heart disease is in the first 48 hours postpartum. Name the part of uterine canal which is attached to the uterus. Isthmus. At 30-week gestation, a mother tells nurse that she is experiencing mild irregular abdominal cramps. The nurse understands that it might be due to Braxton Hicks contraction. What does exclusive breastfeeding means? Option second, giving only mother's milk. Which of the following mental illness has the maximum loss of disability adjusted life year? Depression. Question number 10. Which of the following is an appropriate basic action taken by a shelter nurse at a disaster site to liaise with distressed victim? Option 4, providing basic empathy and dignity. Question number 11. A 3-year-old girl developed fever with a characteristic dewdrop-like rash on her body. It first appeared on the torso and later spread to the arm and leg. There were no symptoms of stiffness and stiffness in the neck. What could be possible diagnosis? Chickenpox. Which of the following statement is inappropriate for a team? Option second, teams work toward individual goals. A community health nurse performs all major roles except option first, prescribing drug. Which is the highest literacy state in India? Option 4, Kerala. Who among the following is responsible for providing and controlling health care service in particular jurisdiction in India? Option second, state. Biological disaster can be predicted from the data obtained from option 4, epidemiological surveillance. Which of the following is a neurological consequence of perinatal asphyxia? Option second, hypoglycemic encephalopathy. Question number 18. Rani brings her young child to the clinic and complains that her child always says no through tantrums and is cookie. Which of the following would explain the behavior of the child? Option first, development of a sense of autonomy. Question number 19. When communicating with a bereaved family, which of the following statement can be used? Option first, I am with you if you want to talk. Question number 20. Loss of control in children during hospitalization can be reduced by increasing freedom of movement, giving them at least which of the following is not a characteristics of caput succedaneum? Option 4, the swelling is limited by the suture. A child is prescribed ciprofloxacin 40 mg per kg per day, 4 doses daily. If the child weight 15 kg. Calculate the amount of one dose. Option second, 150 mg per dose. Common nursing diagnosis used with families of children as seen in ambulances and hospital administrations include all the following except option second, healthy behavior related to lack of knowledge about illness. Question number 24. In the left hand of a male newborn, a painful, scaly, hard lump appears, which is covered with erythematous skin. Which of the following is a complication of subcutaneous fat necrosis? Option second, hypercalcemia. Question number 25. Which of the following is a pre-renal cause of acute renal failure? Option 4, hypovolemia. Which of the following can result in hypovolemic shock? Option first, peritonitis. Which of the following should be evaluated by nurse while providing post-operative care to a lung resection patient as the resection irritates the vagus nerve? Option first, atrial dysrhythmia. Which of the following is an infection that is spread beyond the initial infection site to different part of the body? Option second, disseminated infection. Question number 29. Which of the following is starting medicine for tuberculosis? Option second, isoniazid. Question number 13. What is urine like a smell of breath called uremic fetor? When using a simple mask, what should be the oxygen percentage? Option first, 40% to 60%. What should be the depth of chest depression while giving CPR? Option second, 1.5 inches. The ideal floor area per person is option second, 100 square feet. Everyone should follow the rule of respiratory etiquette to prevent the spread of all type of respiratory infections at the community level. Which of the following does not contribute to the prevention of spread of all respiratory infections? Option second, living in a poorly ventilated room. Question number 35. Which agency deal with global health affairs? Option third, World Health Organization. Which of the following does not apply to level of communication? Option second, personal. Which of the following is considered non-verbal communication? Option second, gesture. A preventive measure that kills most bacteria to ensure a safe supply of milk is pasteurization. The emission of which of the following gases into atmosphere reduces global warming? Oxygen. Emotional health is related to feeling. Which of the following type of patient has the highest risk rate of developing delirium? Option first, patient after cardiotomy. What is the main cause of psychogenic non-epileptic seizure? Option second, mental or emotional process rather than physical cause. Mutism, negativism, waxy suppleness, bizarre posture and subconsciousness are symptoms of catatonic fragmented mind. Which of the following would be the most effective treatment for children with autism? Option 4, structured classroom training in combination with behavioral method. A child who is able to understand and speak a language consistently refuses to speak in one or several social situations. What is this condition called? Selective mutism. A patient has a rapid onset of loss of consciousness, attention, delusion, restlessness, excitement, misperception, and explanation. What is its primary nursing diagnosis? Option third, acute confusion. A patient with a history of fractured psychosis has been admitted for suicidal ideation The patient says, God is telling me to kill myself right now. What is the nurse's best response? Option third, I understand that God's voice is real to you, but I can't hear anything. I am with you. If a nurse caring for a Sannipath patient recognizes that patient has poor willpower, loss of cognition, memory loss, reduced or limited insight, lack of personal control, hallucination, and unstable mood. What should be done immediately after intervention? Will the expected result be as visible? Option first, the patient will be free from injury and develop trust in the caregiver. Question number 49. The nutritional status is estimated as based on measurement of physical dimension and gross composition of a person's body. Option third, anthropological assessment. The positively charged ion present in the extracellular fluid are. Option third, sodium. What is severe acute malnutrition? Option 4, weight is less than -3 for height, 7 score. A dietary intake pattern is a tool used to collect dietary information to estimate the intake of specific food and nutrients consumed during the past 24 hours or 48 hours. Option 4, food frequency questionnaire. Which statement is true regarding menu planning? Option third, it uses a preparation method to retain nutrient in the diet. What percentage of fluid loss is considered moderate dehydration? Option second, 5 to 10%. The main dietary source of vegetable protein is lentils. Which of the following statement about pregnancy diet is not true? A pregnant woman should focus on the quantity rather than quality of diet. Sterilization is a common procedure used in surgical ward. Which of the following options represent the meaning of sterilization? Option first, it is the process of removing a pathogen using steam. Question number 58. What is the next step after a drying person is laid on his stomach? Option 4, mouth turned inward and draining. What do you mean by word drowning? Complete immersion of the nose and mouth in water. In which of the following color-coded container are needle, syringes, a scalpel blade, and glass object disposed of? White box. A nurse is planning a teaching session for a group of parental mother about a balanced diet. What kind of information is the nurse provide? Option first, health maintenance and promotion. What is the technical name for the depicted choking management technique? Heimlich maneuver. What is acute respective shock? Insect bite, spider bite. The patient must begin to accept the chronic nature of diabetes by learning a positive coping mechanism. Under which of the following area of learning can these skills be acquired through learning? Option third, emotional. In general, tissue swelling caused by the accumulation of protein-rich fluid that move through the body's lymphatic system is called. Option second, lymphedema. Which of the following is not a major component of the nephron? Option third, renal column. What is the distinguishing feature of X-linked inheritance? Option first, father cannot pass X-linked trait to their sons. Which of the following cell is responsible for stimulating the sensory nerve of the part of the brain that senses touch and act as a receptor? Second, Merkel cell. Which of the following approaches is not used by doctors in gene therapy? Option first, activate muted gene. Which of the following Nerve originate from the nucleus near the cerebral aqueduct and supplies the oblique muscle of the upper eye. Trochlear nerve. Which of the following test is done to measure the number of dissolved particles in urine per unit of water? Urine osmolarity test. Which nasal structure clean and moisten the air entering the nasal and nasal cavity? Option first, concha. In a hospital, deputed nursing officer conduct annual physical examination of equipments and supplies to note losses and surpluses. This is process stock verification. Which of the following is a nursing care delivery model based on case management? Option first, primary nursing. Which of the following is the focus area for evaluation by NAAC? Curriculum aspect. The number of staff nurses required for a labor room as recommended by staff inspection unit is one staff nurse for each labor table. The process of forecasting the future human resource need of the organization and determining how the existing human resources potential can be utilized is known as option first, human resources planning. Based on size of the hospital, the 200-bedded district hospital has been classified as grade 4. What type of hospital management information system is used in a hospital to link all the data of patient with the information they needed? Option third, entry, discharge and transfer system. Which method of patient care assignment is a combination of functional and team methods used with some medication? Option second, modular nursing method. Sam, Pam, Ram, Tam, Them, and Lam are 6 friends of different height. No two friends have same height. Lam is smaller than only Ram. Pam is shortest. Dam is shorter than Tam but taller than Sam. Who among the following is the fourth tallest? Option third, Dam. The length of breadth of a rectangle field are 10 meter and 6 respectively. Inside the field is a square paddy field whose side is equal to half the length of rectangular field. The ratio of the area the rectangular field to that of paddy field is option second 12 ratio 5. From the given alternative, select the term which can replace the question mark and complete the given alphanumeric series 12CX, 16VE and 24OL, 28HS, 36AZ. Option first 40TG. Which of the following is not a valid tab supported by MS Excel 2019 ribbon? Option second. Option. The Government of India and the Asian Development Bank signed $300 million loan to expand rural connectivity in an Indian state on 8 September 2021. Which state in this is this? Maharashtra. The service enable user to log into remote computer over internet using their local computer. Option first, Telnet. In which state was India's first monk fruit started growing? Himachal Pradesh. If means divide, plus means x, into plus divide means Value of following compression. 15 minus 5 plus 5 into 5 divided by 5. Option 4, 15 correct. The Reserve Bank of India publishes data on 4 alternative measures of the money supply. Baba's tomb is located in Kabul. Simplify the following. Option first is correct. In certain code language, zonal is coded as 895179 and alone is coded as 57498. What will be code for E in the same code language? Option third, 4 is correct. What will be the output of function call floor in MS Excel? Option 4 is correct too. Find the value of following. Option first is correct. Such a special class of computer software that provide low-level control for a device specific hardware is called. Option third, firmware. The salary of employee is first increased by 15% and then decreased by 15%. Calculate percentage change in salary. 2.25% reduction. 6 member of family and F are traveling together. B is the son of C and C is not the mother of B. A, C are married couple. E is sister of C. D is the son of A. F is sister of B. How many children does A have? 3. A single platform for all Indian citizens to access all India e-governance service from the center to the local government body is called Unified Mobile Application for New Age Governance. Pipe A and B can fill an empty tank in 45 minutes and 63 minutes respectively, while pipe C can empty the full tank in 45 minutes. When the tank was empty, initially only 2 inlet pipes were opened, and after a while pipe B was closed as well as pipe C was opened. From the time 2 inlet pipes were opened, it took a total of 75 minutes to fill the tank. For how many minutes was pipe B turned on? Option second, 21. Which of the following is the oldest public sector bank in India? Canara Bank.